Hi everyone, Dr. Shika here from Verve Family Doctors. Please excuse the birthday decorations behind me. They've been up since my daughter's birthday last month, but they're bringing me a lot of happiness, so they're going to be here for a while. But I'm here because it's actually Women's Health Week this week, so I just thought we'd have a bit of a chat about what we as women should be doing to look after our health at the moment. So I think we're all pretty good these days about talking about how important self-care is, and as women we're often juggling so many different things, and it's really easy to start prioritizing everyone else we're looking after above caring for ourselves. But self-care is really so much more than sitting in a bathtub with candles and music, though that can be good sometimes as well. But even if you feel like you're not doing too badly overall, one of the best things that you can do for your self-care is to actually go and see your GP for a routine health check. And depending on your age, there's lots of different things that we might be covering when you attend for a general health check. So asking questions about things like lifestyle factors, exercise, nutrition, smoking, alcohol intake, they're important things for everyone, especially because a lot of us are finding these kind of more basic things that a lot of us were doing very well pre-COVID and pre-lockdowns. They're becoming a lot more challenging. I think a lot of people are slipping into bad habits as a coping mechanism during these turbulent times. But we're not going to be here to reprimand you for any of these bad habits. We're all human and we get it. But we can definitely work with you to figure out little achievable improvements that you can do to reduce your risk of ill health down the track, which is really the goal. And then we'll be doing measurements of things like your blood pressure, maybe calculating your BMI, your waist circumference, urine dipsticks if we need to, and then arranging blood tests for things like cholesterol levels, blood sugars, and checks for common deficiencies, things like iron, vitamin D. They all might form part of your routine checks. And then we can also cover things like sexual and reproductive health, menstrual health, and discussing any concerns that you might have around these kind of topics, which women find sometimes a bit harder to broach on their own. And then as you approach age 50, there's often concerns about menopause, and your GP is the best person to talk through things like what to expect during this time, and what options there are for managing any troublesome symptoms you might be getting. And then there's things like cancer screening, particularly self-breast checks, cervical screening tests for most women. And for those aged over 50, we start adding in things like bowel cancer screening every 2 years and mammograms. And then for older women, we start talking about screening for osteoporosis. And this is something that we'll discuss during your health checks too. And then finally, and perhaps most importantly, is mental health. And this has really been a big concern for so many of my patients recently. These are really challenging times, but honestly, if you're feeling depressed, low, anxious, on edge, irritable, anything that's just not right for you, there's lots of things that we can do to help. But all you have to do is make that first step to reach out, tell us you're struggling, and we'll talk through what the options are. So just remember, ladies, to please prioritize caring for yourself, because as we say, you can't pour from an empty cup. COVID and lockdowns are going to be around for a while yet. But we're all still open here at Verve for all your usual healthcare, and it's really important that we stay on top of our health to make sure that our resilience and our ability to handle whatever it is the rest of 2021 may throw at us is there and is at its prime. Okay, we'll see you soon.